think we're going to go ahead and get started as a couple more folks are coming in towards the end. Okay, welcome to the UNC Water and Health Conference for 2020, and thank you for joining our verbal presentations today on water. My name is Nikki Mankey. I'm with the Water Institute at UNC, and I'm going to be your moderator today for these three exciting verbal presentations. So before we get started, I just have a couple of technical instructions. So this session is being recorded for folks who could not attend this live session. Also, everyone except the verbal presenters have been muted. Please note that all questions should be typed into the chat tab that is on the platform Pathable, the conference platform, within our session today. The Zoom's chat is disabled, so please use the chat tab on Pathable for any questions that you might have. And we can go ahead. Looks like we have a critical mass. So I'm going to go ahead and introduce our first speaker, who is Varun Goel from UNC's Carolina Population Center. You can go ahead and share your slides.
Okay. Hello, everyone, and thank you so much for joining from whichever time zone you are in. My name is Varun Goel. And today I will be presenting results from a National Science Foundation study that looks at whether deep tube wells installed through arsenic mitigation programs are safe drinking water sources in rural Bangladesh. So a bit about arsenic contamination and arsenic mitigation in Bangladesh. So this is a map that shows the current levels of groundwater arsenic in Bangladesh. And if you focus on the areas in yellow and orange, these are the areas that have mean arsenic concentrations beyond the permissible limit as recommended by the WHO and the Bangladeshi government. And this is a really important health hazard because arsenic is highly toxic when it's in groundwater, and it can have a lot of deleterious health effects with long-term exposure. And if you look at the water landscape in Bangladesh, so let's take a concentrated look at this area that I've highlighted. And what we see here is that out of 12,000 drinking water wells that were tested in Bangladesh in 2002-2004 for arsenic, almost 65% of them had high levels of arsenic. And these are mostly shallow tube wells, which are generally 100 to 300 feet deep. And they are the preferred source of drinking water because they're easy to build and households can easily own these wells. So in light of this evidence, there have been two approaches that have been taken to mitigate arsenic exposure. So one is for households to move from these red tube wells to the green tube wells that have been earmarked as safe shallow tube wells and have low arsenic. Or the second approach is to move to deep tube wells. So deep tube wells are generally deeper into the ground and they tap into the aquifer that's free from arsenic. So there's a push now to increase the scale up of these deep tube wells. And that is generally based in this theoretical evidence that deep tube wells should be providing safer drinking water at source. And there's also some studies that have demonstrated that deep tube wells will have low arsenic concentrations for decades to come. There are some concerns too, however. Deep tube wells are generally more expensive, so households cannot really own them. And as we've seen in Bangladesh, even now, most of the households use shallow tube wells, and only 15% households have access to deep tube wells. Another concern is that deep tube wells, because they're low arsenic, there's some concern that low arsenic wells might have high fecal matter due to downward transport. But a lot of gaps remain. So for example, there is still mixed evidence and limited evidence on health effects. And there is some important concern about the potential for risk substitution through microbial hazards. So when I talk about risk substitution, what I mean is when an intervention that's supposed to reduce the risk of one health outcome might end up increasing the risk of another health outcome. So one example of risk substitution in our case can be this situation where deep tube well users who have to walk further to their source might collect large quantities of water and store them for longer times. And what that might do is that might induce more contamination at point of use, hence exposing the households to more contaminated water. So that's what this study set out to do. We looked at the potential, mechanism, and health impacts of risk substitution. And we did that with sub-goals. So we compared the microbial drinking water quality, both at the tubewell source and the point of use among deep and shallow tubewell users. Then we also looked at the socio-geographic context to see what matters and what moderates this relationship of risk substitution. And then finally, we also collected information on actual diarrheal disease risk between the two sets of tubewell users. So here I'm going to focus on the first two results since those are already published, and now we are working on the diarrheal disease risk outcomes. So in terms of the study area, our study takes place in Motla, Bangladesh, which is a rural area 50 kilometers southeast of Dhaka. And two things to note here. So first is that most of these households are clustered patrilineally in these groups called baris. So baris are like a compound where a group of households has a tube well or a pond that they share. So if a household does not have a tube well in their bari, then they might walk to a nearby bari to drink water, or they might walk to a public source such as a tube well in a mosque or a school or a market. And the second thing to note here in this area is that this has a well-established household demographic and surveillance system. And what that enables us to do is to link these rich demographic, spatial, and medical records to any kind of data that we collect. So in terms of the design, we had a prospective cohort study where we enrolled 500 households. We stratified them into groups of shallow tubewell users and deep tubewell users. And we followed them across 4 periods, which contained 2 rainy season periods and dry season periods so that we could capture seasonality. And then finally, a little bit about the data collection. We collected the detailed water and sanitation hygiene surveys, as is the case with many WASH studies. We also collected water quality information for source and point of use. And here we used these tests called the compartment back tests. So I can talk about these tests and how they're used offline if anyone is interested. But basically, these are very easy to use field tests which do not need any incubator or cold chain. And you can measure E. coli as a fecal indicator using these tests. In addition, we also calculated GPS tracks and time travel using a stopwatch by walking with the household member to the source. And finally, we collected information on both self-reported diarrhea outcomes and hospital records that we could obtain through the surveillance system. So let's take a look at some of these results. So first, I'm just going to share a little bit of the socio-geographic context to give you an idea about the differences between deep and shallow tubewell users in our study. So what we find is that, as we expected, deep tubewell users walk 2.5 times further as compared to shallow tubewell users to their tubewell source. They also store water much longer that they collect. And in terms of ownership, many of these deep tubewell users are much less likely to have a tubewell for drinking within their compound, as compared to shallow tubewell users who mostly own the tubewell and have it in their bari or their compound. So when we looked at water quality, what we see is that if we look at the tubewell contamination at source, deep tubewell users did have slightly lower odds of prevalence of any E. coli in their water as compared to shallow tubewell users. However, an important point to note here is that we did find some contamination in deep tubewells. So it's not really the case that deep tubewells are always free of microbial contamination. This story flips a little bit when we look at point of use. So at point of use, what we find is that deep tubewell users actually had slightly higher odds of contamination prevalence compared to shallow tubewell users. It must be noted, though, that when we looked at these results, we did not see any statistically significant relationship. But if we stratify this group of users just looking at deep tubewell users, what we find is that the households that walk more than 100 meters do have statistically significant higher odds for contamination prevalence. So there is a potential for risk substitution because of this hypothesis of distance and water quality at point of use. We also wanted to look at other pathways. And interestingly, what we noticed is that deep tubewell users use surface water for non-consumption, non-drinking water behaviors, much more than shallow tubewell users. So the concern was that even if your tubewell source is not contaminated, if you're using surface water, for example, to wash your storage containers, you might induce external contamination. And since many of these deep tubewell users do not own their tubewells, we were hypothesizing that they might only use someone else's tube well for drinking and not try to overuse it for other purposes. And that's what we find in our results that have also been published, that the risk of surface water use is modified by ownership. And even if you just look at deep tubewell users, those who do not own their deep tubewells and have to go to another compound have higher risk of washing their storage containers with surface water. Interestingly, though, we do find that deep tubewell users have higher odds of surface water use, even if they have a tubewell inside their compound as compared to shallow tubewell users. So that's something interesting to note too. When we wrap this all together in discussion and policy implications, what we find is that the potential for risk substitution exists, and maybe not through one, but multiple pathways. And in terms of increasing access, what we might want to note is that even though we can scale up and build more and more deep tubewells, increasing the access might not take out this risk of this risk substitution vulnerability completely. And I think one concrete way to think about this is to think about household water safety plans that have been successful in Bangladesh, but they have not been updated. So I think one component that can be used in these plans is to also talk about non-drinking water behaviors and what can be some of the interventions. So because of the fact that contamination in drinking water can be induced from outside factors too. And then finally, I would just also want to point out that most of the studies that we've come across look at distance as a physical measure and a barrier to access. But I think factors such as ownership can add more dimensions to it and should be considered when looking at differences. So ultimately, I would just like to acknowledge the team at UNC Chapel Hill and this whole team at ICDDRB, without which this could not have been possible, and our funders from the National Science Foundation that made the research possible. Thank you, and I would entertain any questions that there might be.
Great, thank you so much, Varun, for a great presentation. It's always exciting to hear about things going on at UNC beyond just the walls of the Water Institute, so thanks for sharing. So if anyone has questions, there is one that I'm about to read, but for people who might have questions about the presentation, please go into the Pathable platform onto this verbal event page and post your questions there, as the Zoom link, the Zoom chat will not work. There's a question from Joanne Barlow. It says, based on percentage of intermediate or greater risk, it seems there's very high recontamination during the transport and storage, as that seems to be the biggest issue. It's kind of a question, kind of a statement.
Yeah, no, that's true. I mean, these were results actually just for the dry season where we expected lower contamination. If you look at the rainy season, which is something that we're working on in the other paper, 80% of the tubewell users had contamination, and even the high risk tubewell users were in an upward range of 70%. So yeah, like I think coming to your question, the main answer is that yes, even though tubewell source is a slightly important source, is slightly important pathway where we can reduce risk, the point of use is where we might need to focus more.
Great, thank you for that. We have time for another question or two. Just gonna give everyone their last chance to post in the chat. Oh, there we go. How many tube wells, including DTW and STW, did you survey?
So we surveyed 500 tube wells total. So shallow tube wells are readily available. So we got an easy hit for 250 shallow tube wells. For deep tube wells, we did have to oversample because only 15% of users in our study area use deep tube wells. So yeah, so 250 each. And some dropped out during follow-up, but the numbers are still in the upward of 230.
Okay, last chance. Anyone got some straggling questions? We're about at time anyway. Oh, one more question. Okay, was there any quality difference in source in dry to wet season? So you mentioned the dry season.
Yeah, so this is very interesting. So generally the water safety plans have mentioned that deep tubewells are safe during the dry season and that contamination is only a problem during the monsoon. So what we find is actually that there's not much difference between these numbers during the dry season versus the numbers during the monsoon. So actually, I think one takeaway from this in terms of evidence-based decision-making is that we cannot be complacent about deep tubewells not having any contamination during the dry season. So we would have expected monsoon to have much higher contamination numbers, but that's not the case. We are seeing similar numbers in the dry and the rainy season.
Great. Well, thank you so much, Varun. Really appreciated your presentation and you answering those questions. If anyone else has questions about this presentation, the chat saves after the presentation, so the speakers can go back and look at them and answer them through the message feature. So next, we're going to move on to our second presenter, who is Chloe Poulin from the Acquia Institute. Chloe, could you go ahead and share your slides, please?
Sure. Hi, everyone. I'm going to switch on the video just to make sure I have a good internet connection. So thank you for being here virtually. Okay, I hope you can see the slide right now.
We can. Thanks.
Okay, perfect. So today I'm going to talk about the environmental factors that influence the concentration of fecal and bacteria in groundwater, with insight from explanatory modeling in Uganda and Bangladesh. So this research has been funded by the Hilton Foundation, and that paper has been accepted at ENCMT. And for this talk, I will mainly focus on Uganda. So the SDG number 6.1 called for universal and equitable access to safe and affordable drinking water for all by 2030. But water safety management requires information about contamination level to guide decision on source protection and also treatment approaches. But water quality information is scarce, and water quality monitoring is particularly difficult in rural area, especially for dispersed non-pipe system, due to limited resources and personal capacity. It's therefore important to develop alternative approaches for identifying groundwater resources prone to fecal contamination. So one such approach is to use environmental conditions known to be associated with poor groundwater quality to aid in the identification of untested sources with poor water quality. Prior research has already identified several factors affecting surface and groundwater quality, like precipitation, livestock, geological characteristic, and etc. But its studies usually focused on small geographical areas. So here, we propose an approach that combines satellite imagery with census and hydrological data to better understand variability in microbial groundwater quality over large spatial scale. So we got data, we got microbial groundwater quality data, E. coli or thermotolerant coliform, from 3 different organizations in Uganda. These are Water and Health for All, WAVE, and Water Mission. So we got a total of 3,375 points spread in 26 districts out of 56 in Uganda. So the map is showing the repartition of the different wells and their level of contamination split in the 4 categories according to the WHO guideline. So in yellow, these are the wells that are non-contaminated with a concentration of 0 CFU per 100 milliliters. And the dark red represent the high contamination in groundwater with a concentration above 80 CFU per 100 milliliters. For our statistical analysis, we derived the binary variables. So we recorded all the wells that are above 1 CFU per 100 milliliters as 1, and all the wells that are equal to 0 CFU per 100 millimeters as 0. So before starting the statistical analysis, we established a conceptual framework for examining association correlation between microbial groundwater quality and the potential risk factors. So we have identified 14 different risk factors divided into 4 different groups. So in orange, we have the factors that are associated with human activities like time to city, which is an indicator of remoteness, population density, livestock, land cover. In green, we have the climate and the hydrological factors like temperature, runoff, precipitation, soil type, flooding. In red, these are the non-anthropogenic microbial sources like wildlife feces or the E. coli that can be found in sediments, for example. And in blue, we have the factors that are related to water and sanitation infrastructures. So the arrow demonstrates the direction of the relation between 2 factors. So for example, if we take runoff has direct impact on water quality, but runoff is also related to land cover and to precipitation. So if we want to assess the impact of runoff on the groundwater quality, we have to take into account land cover and precipitation, called confounders, and we need to take them into account in our statistical model. So we managed to get data for 7 out of the 14 factors. So we get data for time to city, for population density, for livestock, for land cover, runoff, and precipitation. And then from this conceptual framework, we derived the appropriate statistical models for analysis. So I'm going to present you the result for the binary variable. So for this specific variable, we used a logistic regression to assess which environmental variables are related to the groundwater quality. So the graph on the left summarizes our statistical analysis. For each factor, we have an odd ratio, which is the measure of association between 2 variables. So if the odd ratio is above 1, we have a positive association. If it's below 1, we have negative association. And if it's equal to 1, we don't have any association. And we also have a p-value that tells us whether or not our results are statistically significant. So for example, on this graph, we can show that if we have a lot of cropland around the well, we are more likely to have degraded water quality. As the opposite, if the well is far away from a city, we are more likely to find a good water quality. So to make these results a little bit more understandable, I translated them into a table. So the green positive sign represents a positive effect on the contamination. The red negative sign represents a negative effect, and the null sign a null effect. So for Uganda, we found that a high percentage of cropland around the well, a high runoff, high population density, high livestock density, and high precipitation are associated with degraded water quality, while low groundwater contamination is more likely in areas further from cities or with high forest coverage. And for Uganda, we found that temperature, grassland, and wetland don't have any effect on the groundwater contamination. So it's important to note that these results are not universal. For example, for Bangladesh, we found opposite results for some variables. So for example, we found that high cropland coverage is associated with better groundwater quality, while high forest coverage is associated with contamination in groundwater. So we then transformed this result into a groundwater contamination index that is divided into 4 quartiles. So the first quartile in green shows areas that are more likely to have good groundwater quality. So it means that these are areas that are more likely to have a low density population or a high forest coverage, or this area will be far away from city. And the last quartile show the area that are more likely to have a highly degraded groundwater quality. So for example, will be area with high population density, close to city, with high precipitation or high runoff. And so we overlaid this map with the population density map, and we calculated that 25 million people are living in areas that are prone to microbial contamination. So this map can support planning and advocacy. So for example, we can overlay this map with poverty incidence or disease burden to identify vulnerable areas and prioritizing program in those areas. it's important to note that this map is not static and can be updated every month, depending on the precipitation, for example. And we can also use this map to anticipate how future trends in climate change and land occupation, for example, are likely to impact groundwater quality. So as conclusion, we showed that it's possible to use datasets on environmental condition derived from satellite imagery, census, and hydrological data. They can be used to identify risk factors associated to groundwater fecal contamination. A better understanding of these risk factors can help decision makers in prioritizing intervention, allocating resources, and forecasting future trends through the map. And it's also important to note that these risk factors can vary across contexts that highlight the importance of replicating this type of analysis to specific geographies. I also would like to highlight the fact that groundwater is not visible, it's underground, but we succeed to explain what is happening with surface metrics. So it's sort of proof of concept of what is happening in surface can help to understand what is happening underground. And so as next step, we will try to apply predictive modeling techniques to develop a risk map for Africa. And so we welcome any data set on microbial contamination if they are georeferenced. Thank you for your attention.
Thank you, Chloe. That was right on time. Thanks for a great presentation. We already have a handful of questions for you. Wow, they're really popping in quickly. The first question is, whoop, I lost it because they're coming in so quickly. Hello, could you tell me a bit more about how you created the map of groundwater contamination index?
Yeah, it's a good question. So from the results from the logistic regression, then we use an algorithm called CART or R to identify like cut point. It means that to find the optimum cut point that will split, for example, the cropland into two groups, one group with a majority of non-contaminated wells, and the second group will have a majority of contaminated wells. So for cropland, we found that if the percentage of cropland is superior to 60%, we are more likely to have groundwater contamination. And so with this cut point, then we use the method, we apply the method used to calculate the wealth index in the demographic and Earth survey. So for all of these factors, we use the PCA to find the weight of all of these different factors. And then we recorded all the pixels from the map according to this weight we found on the PCA. And then oh, sorry, I can start my video. And then we derive the map through this whole process. I hope it's clear enough.
Yeah, great. Thank you so much. The next question is, how does population density act differently for the two countries?
It's a good question, actually. We don't really know. I mean, we have also time to city, maybe population density for Bangladesh. For Bangladesh, yeah, population density doesn't act as, doesn't have any effect on the groundwater contamination. So we just think that they have a better sanitation infrastructures that don't, with this better sanitation infrastructure, we might have like less groundwater contamination and less leakage from this sanitation infrastructure into the groundwater.
Great, thank you. We have a question that says, can you focus on the variables that have opposite effects in Uganda and Bangladesh, and then explain why that might be?
Yeah, so Uganda, Bangladesh. So for example, the percentage of cropland. So for Uganda, we think that we might have like more open defecation in this like farm area and around this cropland. That might be not the case in Bangladesh because the open defecation rate in Bangladesh is lower than Uganda. For forests, it's a good question. We don't have, so if in Uganda, if we have a high percentage of forests, we are more likely to have better, a better groundwater quality, which is not the case for Bangladesh. So we think that for Bangladesh, it might be, even though the open defecation rate is lower in Bangladesh, it might be the explanation of why we have like more contamination in the forest, because it might be like the area where people are still continuing to open defecate, and the forest in Uganda might be like really further away from city, and we might have like less density population in Uganda around this forest area, and so less contamination.
Thank you. And we have time for one more question. It says, thank you for the presentation. How does your model represent potential variability of groundwater quality at a single location? For example, at a given location, we might expect that a borehole drilled and screened in a confined aquifer might have different water quality than a shallow hand-dug well.
Yeah, yeah, it's a good point. So unfortunately, we don't have like any data on the geology. But this is true that this map is a map at large scale, and this is true if you zoom on a specific area. It might not be it might not be really accurate, because it's true that you can have like different parameters that influence the groundwater locally and that are not captured at large scale.
Great. Well, there's a few others, so you might want to look at those and answer them in the chat box, Chloe, but thank you so much for your presentation. And we're going to move on to our third and final presentation, which is Julie Powers from Tufts University. Julie, could you go ahead and share your screen, please?
Hey everyone, my name is Julie Powers and I'm a PhD student at Tufts University in environmental engineering. Thanks for joining. I will be presenting today on the effects of temperature and precipitation on levels of E. coli in drinking water and on child hands. Due to climate change, in East Africa, mean annual temperature is expected to increase 2 to 4 degrees Celsius by mid-21st century. Precipitation projections are more uncertain and vary by region, but suggest a possible increase in the intensity and frequency of extreme precipitation events. Multiple studies have shown that higher ambient temperature and heavy precipitation are associated with increased prevalence of diarrheal illnesses. Diarrheal pathogens can be transmitted through several environmental pathways, including water, hands, fomites, food, soil, and flies. Heavy rain could lead to flooding and fecal contamination of household environments and water sources, and high temperatures could also reduce E. coli survival and growth. People might also react to weather extremes in ways that influence their exposure. A few studies have found links between temperature, precipitation, and water contamination, but we are not aware of any prior studies that have linked temperature and precipitation with hand contamination. So more evidence is needed in both of these areas to provide evidence of the causal mechanisms. So our objectives were to examine how variations in temperature and precipitation are associated with household E. coli levels in source water, household stored water, and on child hands. And you can see on the right here, this is our study area in rural Western Kenya. We paired household E. coli contamination data with publicly available temperature and precipitation data using the GPS coordinate of the household and the date of the sample collection. The E. coli data in this project comes from the WASH Benefits Kenya trial, which was a cluster randomized control trial that evaluated the effects of water, sanitation, hand washing, and nutrition interventions on child health outcomes. And environmental E. coli contamination was assessed in a subset of this study. The precipitation data comes from the CHIRPS data set, which is a global data set that has 0.05 degree gridded rainfall time series data for daily precipitation. And then temperature data comes from the NCEP data set, which has 0.2 degree resolution and 6 hourly maximum temperatures. First, we extracted the temperature and precipitation data using Google Earth Engine code editor using the GPS coordinate and the date of sample collection. We then created threshold predictor variables. We decided to use thresholds because we expected that the effect of temperature and precipitation might only hold at high temperatures and high precipitation and might not be linear across the whole range of weather conditions. We selected 32 degrees Celsius and the 90th percentile for rainfall because these come up frequently in climate projections and also in diarrhea risk studies. We considered the combined effects of temperature and precipitation in multivariate regression models. For source and stored water, we controlled for improved source, and then for stored water and hands, we also controlled for treatment arm. We also performed a subgroup analysis by 8-week precipitation tertiles. We did this because some studies of diarrhea risk have found that the effect on diarrhea holds only after a prolonged dry period. This is potentially could be because the dry periods allow contaminants to accumulate in the environment. One of the strengths of this study is that we had really large sample sizes for environmental samples with over 12,000 samples collected. I also want to note that the prevalence of E. coli was really high across the board. Over 90% of samples had detectable E. coli, regardless of sample type. So moving into some source water results, we found that heavy precipitation was associated with increased E. coli levels in source water. And we found that this, the magnitude of this effect was larger after low 8-week precipitation. We also found that high temperature was associated with increased E. coli levels in source water. However, 8-week rainfall did not modify this relationship. Moving into household stored water. In stored water, we found that heavy precipitation was not significantly associated with E. coli levels overall or at any of the levels of 8-week precipitation. Similarly, high temperature was not significantly associated with E. coli levels in stored water overall or at any of the levels of 8-week precipitation. For hands, heavy precipitation was not significantly associated with E. coli levels on child hands. However, high temperature was associated with decreased E. coli levels on hands, and the magnitude of this effect was actually larger after low 8-week rainfall, meaning that it was more negative after low 8-week rainfall. One of the limitations of this study was that data was not collected uniformly based on the time of year. So in this graph, we can see average monthly rainfall for our data in the left y-axis, and on the right y-axis is the number of source water observations. So you can see that different months of the year, such as July, have a lot of observations, while some times of the year, such as May, have relatively few. This means that we might have undersampled or oversampled weather conditions at certain times of year. However, this is mitigated by those really large sample sizes. Another limitation is that the spatial resolution of the temperature data was not quite as good as the spatial resolution of the precipitation data. The temporal variation in the sampling dates helps to mitigate this because the temperature varies by geographic area, but also by the date that the sample was collected. Our findings indicate heavy precipitation conditions elevate E. coli concentrations in drinking water sources, potentially due to contamination of water sources from human or animal fecal waste from surface runoff or flooding. This association did not hold for household stored water. One potential explanation for this is that we found that participants were more likely to report doing something to make their water safer to drink after heavy rainfall, perhaps responding to perceived changes in water quality. High temperatures were associated with decreased E. coli levels on hands. This could be due to the impact of sweat, die-off at high temperatures, or perhaps even behavioral changes such as different agricultural activities based on the time of year. We also found that long-term rainfall modified the effects of heavy precipitation on E. coli levels in source water, and the effects of high temperature on E. coli levels on hands. For both of these, we found a larger magnitude effect after low 8-week rainfall. Climate models predict that increased mean annual temperatures are expected to rise and that we might have increases in the intensity and frequency of extreme precipitation events in East Africa. These results imply that higher temperature and more heavy precipitation events could lead to increased risk of E. coli transmission in water and suggest that water treatment could be a useful mitigation strategy. The results also imply that higher temperatures could reduce the risk of E. coli transmission on hands. I would just like to acknowledge and thank everyone who went into making this work possible. And with that, I would be happy to take any questions. Thank you.
Thanks so much, Julie. Really appreciate it. Great presentation. We have a question here from Caroline Dallaire. Hi, Julie. In cases where you did not find a significant association, have you tried different thresholds?
So we have not tried different thresholds, though I think that that would be something useful to do as a sensitivity check. So that is something that I'm working on right now. And if you email me, I'd be happy to share the results with you when they're ready.
See if another question comes in. Oh, here we go. I'm also using the CHIRPS data set and found that surface water depth is a more accurate predictor of pump usage in my case. Would that be a more direct predictor variable for you?
Of pump usage?
Surface water depth.
Okay. Surface water depth. I'm not familiar with that data, but yeah, I would be interested in chatting and looking at it. We have a variety of different kinds of water sources, so I don't know if that would apply to all of them.
Kind of on that note, someone asked, can you tell us a little bit about the water source and the water stored in your area of study?
Yeah, so water sources are, there's a lot of surface water sources such as rivers, ponds, there are protected springs, unprotected springs, a few boreholes, almost no piped water, yeah, a few unprotected wells, and not many protected wells. Yeah, so I think commonly a lot of surface water and springs.
Right, and the storage, that was another part of the question.
Oh yeah, and the storage, commonly people are storing water in jerry cans. And one of the things that I've been thinking about is whether the amount of time that people are storing their water could have an impact. So one of the things that I want to look at is looking at different lag periods. However, most of the people in the study area are storing their water for like at most 1 or 2 days. So I don't think it should make a huge difference in terms of the lag period for the weather variables, but something that I'd still like to look at.
Thank you. I actually have a question for you.
Yeah.
So did you look at the effects of on E. coli prevalence or only on E. coli levels?
So since the prevalence of E. coli was really high, we go back. We had over 90% prevalence of E. coli in all of the sample types. So we didn't think that there would be enough variability to look at presence or absence of E. coli. So that's why we decided to just look at E. coli levels.
Got it. Okay, thanks. And there's another question. This will be the last one. Would there have been more correlation between E. coli on the hands of adults collecting source water as compared to children?
Maybe, but I think what we are interested in, the reason that child hands are used in this case is because we often think about very young children as being the most at risk. So we were interested in understanding the risk for children specifically. But yeah, it would be interesting to also look at caregiver hands as well.
Great, thank you so much, Julie, really appreciate it. And thank you to all of our different speakers, all three of you. You did a great job, and there's still a couple questions left over for you too, Julie. So everyone who presented can definitely go look at the chat box and respond to those individually. So thank you all for joining this verbal presentation session. Really appreciated it. And just one note, we have a poster presentation happy hour session happening in 13 minutes. So grab a snack, grab a beverage, whatever you might like. We just sent out an email with a featured wash cocktail. It's called Muddy Water. Don't know if it's good or not, but hope to see you all at the poster sessions. And thanks again to all of our speakers.